I'm Laura von Wüllerstorff, and I'm core faculty instructor for ASPIREOMT, and today we're going to talk about assessment and treatment of the talocrural joint. Here we have a patient coming in with complaints of left ankle pain. So one of the first things we're going to do is look at functional movement, which is going to be a squat. When he squats, we're going to see that there was a restriction in left talocrural dorsiflexion. We then have him pull a little bit more into overpressure, and we'll feel that there's more give on the right and there's a block on the left. This will indicate that we need to check him in non-weight bearing, and we'll use the Taylor swing test. So now we place our patient in a sitting position, and we're going to use the Taylor swing test. This is to help us differentiate between soft tissue restrictions, capsular tissue, or actual true joint subluxation, which is going to require a manipulation. So we place our thumbs on the talus, bring the foot in neutral, and we move him into a posterior glide. What we should feel is a glide of the posterior glide of the talus with its conjunct external rotation. If this is felt, this indicates a normal Taylor swing joint, and therefore we know that the structures that are limiting the dorsiflexion are extracapsular and soft tissue. If, on the other hand, we do a posterior glide and we feel there is a joint restriction and there's no glide, we then think, okay, is this capsule or is this an actual subluxation? We will then add a traction to the talus and then see if we can get further motion. If when we traction and we get further motion, this is an indication of a subluxation. If, on the other hand, we then traction and we still don't get any motion, we have a positive for capsular tissue restriction. And we need to do mobilization techniques. Okay, in our patient, we had a positive Taylor swing test for a subluxation of the talus. And one of the treatment techniques we're going to use is a distraction technique. Now, before we do a distraction technique, we must be able to test the talocrural joint for stability, and that has to be negative. If it is positive, then we have a taping technique that we demonstrate in the class that can stabilize the distal tib fib joint prior to this manipulation. The other thing you need to ask is you need to explain to the patient what you're going to do and why you're doing it and get consent. So after we've done our explanation to the patient, we've done our stability test of the talocrural joint, we have a positive Taylor swing test for a subluxation of the talus, we're going to demonstrate a distraction technique of the talocrural joint. Seeing that this is his left foot, we put our left hand close to the joint line. So right on the talus, the neck of the talus, we take our other hand and we put our other hand on top of the other hand. We're going to bring our elbows in, not to produce too much force. With your elbows out, you can produce a lot of force, so we bring our elbows in to keep the amplitude short. We're also then going to do a pre-manipulative hold to just see if that is okay. After he does that, we'll relax. We then are going to do a short amplitude, quick acceleration at the end of the range. So the pressure is right on the neck of the talus. We feel the end, and we give a quick thrust. If you found this video interesting, check more of our courses at ASPIREOMT.com.